Good afternoon, everyone. We've got a full house today, and it's on a really important topic. It's on healthcare. You know, I see people across this country, in every state, struggling with the ability to get healthcare. And some of it has to do with the fact that healthcare is super expensive. Premiums we've seen go up across the country, and we've certainly seen it here in Massachusetts. We've also, seen and heard so many stories from people just about the challenges right now of navigating the healthcare system in America. But as governor, my commitment to you is to take action in whatever way we can here in Massachusetts, because we cannot wait for Washington, okay? So today we've come together, and you see folks from all over in all parts of healthcare and the intersection with healthcare, and you're going to hear from some of them. But what today is about is how can we in Massachusetts right now to take action on making healthcare more accessible, more affordable, okay? And I just really appreciate the chance to be here with the Lieutenant Governor, Kim Driscoll, our Secretary of Economic Development, Eric Paley, Secretary of Health and Human Services, Dr. Kiami Mahania. We also have Undersecretary Leila D'Amelia of the Office of Consumer Affairs and Business Regulation, Undersecretary for Health Amy Rosenthal, Commissioner of Public Health Dr. Robbie Goldstein, Executive Director of the Health Connector Audrey Gasteyer. We also have Matt Vino of GIC, Andrew Yakma of the Center for Health and Information Analysis, and David Seltz of the Health Policy Commission. And we also have, you'll hear from him later, our Commissioner of Insurance, Mike Caljo. Big thank you to you and the entire team at the Division of Insurance for the work that you've done to make possible the changes on prior authorization. And you did that in conjunction with some of the folks represented here. Health insurers. We really appreciate the partnership of health insurers and coming together to figure out how can we better deliver health care to people in Massachusetts. I also see a number of healthcare providers, hospitals, community health centers, doctors, nurses, healthcare workers, patient advocates, large employers, small businesses, and experts. We also, of course, have members of the legislature with us. I want to thank chairs of the Healthcare Financing Committee, Senator Cindy Friedman, Representative John Law, Chair Marjorie Decker of the Public Health Commission, Chair Tom Stanley of the Committee on Aging and Independence, Chair Paul Feeney, the Committee on Financial Services, Chair James Murphy on Committee on Financial Services, Governor's Counselors Tara Jacobs and Tamisha Silbo. That's a lot of folks, okay? It's a lot of folks, but I also want to thank Senator Bill Driscoll, Public Health Chair, and I think we have Rep. Machino here as well. Look, it's a lot of folks, but there are just issues that are so important to people. And healthcare, being able to take care of yourself, being able to take care of your kids, to make sure that your loved ones are going to get the care that they need in the time that they need, in a way that you can actually afford without bankrupting yourself or your family. This is an issue that requires work on the part of all of us, inside and outside of government. And as I say, we cannot wait for DC to act. We cannot wait for a federal administration that took $1 trillion out of healthcare this summer. We cannot wait for a Congress that is not able to get anything done. We've got to take action here in Massachusetts to do whatever we can. So let me tell you a little bit about what we are doing today. Better think of it this way. How many of you have had the experience of you're having an issue and you go to the doctors and you get a prescription for a medicine or a treatment, and then you want to go and pick up the medicine or start the treatment, but you find out you've got to wait. You've got to wait because something has got to be okayed by your health insurer. And we know that because we've had these experiences where that approval can take a bit of time, and people end up having to wait, and they have to wait. Their doctors have got to send more forms into the insurer, and you got to wait on that approval. And the whole time that you're waiting, you still got the condition that brought you to the doctors in the first place. So you're continuing to suffer. You're not getting the treatment that you need, and things can get worse. things can get worse. And sometimes, because some of these prior authorizations require you to fill out forms or go to websites, people don't have time for this, right? If you've got an issue, we want to see that taken care of right away. So this is what we're doing today to deal with these frustrations, because I know, we've all had the experience where you lose time, you have to wait, people have to take time off of work to go back for other appointments. It ends up costing money, and a lot of times it's for a treatment or a medicine that is routinely used and commonly approved, right? 99% of the time. So these are frustrations that people across the country are experiencing, but I want to make sure for people in Massachusetts, we do everything we can to eliminate those frustrations. And here's what we're doing. Through our Division of Insurance, Commissioner Caljo and the team, they studied this over the last several months, and they found huge inefficiencies in the system. They found that the system didn't exist in a way that provided access to regular, balanced quality and care, controlling costs. It just wasn't really working. It was adding time, adding costs to things. So here's what we're doing. Today we're changing that. We're getting rid of prior authorization for a whole bunch of situations. That's what we're doing, okay? It's good. It's good because we're cutting the red tape that stands between you and healthcare. From now on, a wide range of medical drugs, services, and equipment will no longer need any prior authorization at all. It includes primary care, emergency care, chronic disease management, vaccines, reproductive care, maternity care, physical therapy, substance use services, and so much more. I'll give you an example. Anybody have diabetes? If you have diabetes, you will not need a prior authorization for the insulin, for the pump, for the appointments, or for anything you need to treat this chronic illness. That's just one example. You won't need it for the first time or for subsequent appointments. You won't need it for any adjustments or upgrades that you get. And you won't need it if you change jobs either, okay? So that's what we're doing here today. In addition, for any urgent requests, plans will be required to respond within 24 hours, the quickest turnaround of any state in the country. That's what's happening today. And if you change plans, your new plan has to honor that prior authorization, that existing authorization, so there isn't any interruption. And the plans, these insurance plans, will have to make all of their practices public so that there's no mystery for a patient about what's covered or not. Again, I want to thank Commissioner Caljo. I also want to thank the plans, the insurers who work together with our office to figure out a better way to ensure that people are having access to timely care. We also, in this state, talk about the fact that we have the best quality hospitals, providers, and healthcare. We know that we're #1 for quality of care. We're #1 for coverage. And as a result, we have some of the best health outcomes in the country. But as I said earlier, here we see, as we see across the country, that costs have gone up and people can't afford it. And the healthcare system in this country is not working. It's not working. It's a fact that we need to find a better way to make sure that people get health care in this country. And I'm not prepared to wait for action out of DC. 20 years ago, it was people in Massachusetts who came together and established a model of health care that ended up being copied on the federal level and changed our country for the better. And it's now time to do that again. We've got to find a way to rein in costs, to make healthcare more affordable, and to make it easier. And as I say, regardless of what's happening in Washington, we are moving ahead in Massachusetts. I have established a healthcare affordability working group. It's something I'm announcing today. It will be led by our former Health Secretary, Kate Walsh, and Citizens Bank President Lisa Murray. both accomplished leaders in healthcare, in business, who have seen up close the costs of healthcare and what's happening in the healthcare system. We also have a working group that consists of people with a lot of expertise, including from hospitals, health centers, employers, importantly, health plans, patient advocacy groups, and the like. I want to thank them for their commitment to serve. Look, I'm setting up this working group because I want action, okay? I don't want a protracted process where we study an issue, for months or years at a time and come out with some blue ribbon report. I want these folks on this working group to get together and to think about new and innovative ways. We must think about new and innovative ways, things that haven't been done before, to fix a system that is not working. In Massachusetts, it's not working, and in America, it's not working. But my money is on the people in Massachusetts and the expertise that we have in Massachusetts to figure out a better way forward. So that working group is going to get to work quickly, and I'm going to be regularly checking in with them. And there may be some things that we can do right away. There may be things that take a little bit longer. But the idea is that we're taking action here in Massachusetts today to lower costs, to make healthcare more affordable, and to create a better model and a better system that will serve our residents. I want to thank everybody for that. And with that, I'd like to invite Secretary Paley up.
Thank you so much. Good afternoon, everybody. I just want to start by thanking the governor and the lieutenant governor for always driving Massachusetts to lead. This is another example. They drive all the secretariats to say, we can't wait for the federal government, we can't wait for anyone else. We need to step up, we need to lead, and thank you for that. I want to thank the teams that made this possible. DOI Commissioner Caljo, thank you so much for your work, your staff, putting this together. OCABRA's Undersecretary Leila D'Amelio. OCABRA is constantly looking for ways to cut regulation that is slowing things down, making it less efficient to do business, but also looking for how to protect consumers and make the consumer experience better, and that's what today's all about. Health and Human Services for its close partnership on this, and all the industry stakeholders who help make this happen. Thank you so much. One of our greatest strengths here in Massachusetts is quality of life, right? We benefit greatly from our incredible hospitals, our universities, our school system, research institutions. Globally, we are respected for all of those things. It's a big reason why people choose to live here, why businesses choose to be here. And this is the key that we have to keep building upon. When healthcare is slowed down and unnecessary paperwork and efficiency gets in the way of patients getting good care, slows down our businesses also in delivering the quality of that care. It creates stresses for families, and it pulls people away for work, which also injures our economy. It's putting pressure on employers as well. We have to look for opportunities to fix those problems, and this is a great example of what we need to do that helps drive the competitiveness of our state and prevents us from undermining that quality of life. Reforms announced today absolutely help solve those problems. Streamlining the process, reforming prior authorization, creating better patient care while removing business inefficiency. We're helping those patients, we're helping those families, we're lowering costs throughout the system. A strong economy ultimately depends on a healthcare system that works. The healthcare system is incredibly challenged today. The committee that's being created to help drive and solve that is a key step forward in trying to move us forward from the challenges we face. Today's actions reflect a broader commitment to protecting our quality of life, strengthening our economy, keeping the Commonwealth competitive, solving key problems that people feel every single day. So thank you all for coming together on this. I'm going to turn it over to Secretary Mahania, my partner on this, and he will take the podium from here.
Thank you. Good afternoon, everyone. I'm thrilled to be here to be part of the announcement of the formation of our healthcare affordability work group. Thank you, Governor Healey, for your consistent leadership, for believing in science and medicine, and for working to keep Massachusetts the best state in the country for healthcare. As some of you may know, I'm a trained physician in the field of addiction and primary care. One of the true blessings of my life is that every Monday, I still get to see my patients at the Lynn Community Health Center. At the health center, I see firsthand how important it is to be able to access affordable health care. There are far too many families making decisions about health care based on whether or not they'll be able to pay for their groceries, pay for their rent, or heat their homes. Our healthcare system has reached a breaking point where costs are fast outpacing our ability to pay for care. We have a shared responsibility across government, industry, labor, academia to build a better, more sustainable, and more affordable system. Luckily, here in Massachusetts, we have the greatest minds in the country to help us do that. Under Governor Healy's leadership, we have empowered two of those great minds to chair this work. My immediate predecessor as UHHS Secretary, Kate Walsh, and the Massachusetts State President of Citizens, Lisa Murray. The working group and its subcommittees will answer 4 central questions. How do we make sure to provide the care patients need in the right setting at the right time? What innovative ways can we devise to pay for healthcare services? How can we make the system more efficient and reduce waste? And how do we make sure our hardworking medical professionals are working at the top of their licenses and using technology to improve patient care? I want to thank the members of the working group who have answered the call. With representation from across sectors, you all provide critical and unique perspectives as we tackle these challenges head-on. We look forward to continuing to drive innovative solutions to this affordability crisis and working together to build a system that can support the needs of everyone in Massachusetts. With that, I'd like to introduce my soon-to-be next best friend, one of our working group co-chairs, Lisa Murray.
Thank you. Thank you, Governor Healey, OPLG. Thank you, Secretary Manaya and Secretary Paley. Good afternoon, everyone. My name is Lisa Murray, and I am the Massachusetts State President at Citizens. I am truly honored to have been asked to co-chair the Healthcare Affordability Working Group alongside Kate Walsh, who unfortunately couldn't be here today, but I know we are both looking forward to jumping in and tackling this issue. Access to affordable healthcare is a critical component of strong communities, and we are facing a healthcare affordability crisis that is impacting consumers and employers. For those in the business community, we all know too well that many commercial health plans have become unaffordable, particularly for small and medium-sized businesses. We have seen premium rates grow, reflecting an overall increase across the entire healthcare system, and it's simply not sustainable. That is why convening this cross-sector working group is a critical step towards ensuring sustainability and affordability. We have the opportunity to act as leaders and position Massachusetts as a state where employers can offer affordable health care options to attract and retain talent. Our state has a tremendous legacy of the government and the business community working together to solve big problems. And I look forward to helping drive solutions to make Massachusetts a more affordable state to live and work. I want to again thank the Governor for this tremendous leadership in this area. And now I'd like to introduce the Commissioner of Insurance, Michael Caldo.
Good afternoon. Thank you first to the Governor and Lieutenant Governor, the Secretaries and Undersecretary, and all of the other directors and public officials here. Your leadership on modeling public service every day is an example to me that I carry forward. I'll be brief. Today is a really important day. It's an important day because it's evidence of what is possible when all of us in healthcare come together and tackle hard problems. I want to thank all of the stakeholders who are here today and others who aren't here for their collective willingness to engage, to problem solve, and stay at the table on hard issues. We're going to be making a difference in people's lives because of that collective action. I say often that we have the best insurance industry in the country, and today is evidence of that work. And collectively with other stakeholders in the hospital and health plan community, as well as in consumer advocate land, we really have done a lot to take action to reduce administrative waste, improve access to health care, streamline and standardize prior authorization requirements. You should know I'm deeply committed to seeing this work through to its completion. Every day, patients are struggling to navigate an incredibly complex healthcare system. Also, at a time when every dollar counts, this action will align spending with improved patient access and affordability, central tenets that we all need to take attention to. You're going to hear next from a patient who will share her own experience with these issues and talk about the importance of our reforms. And with that, it's my honor to introduce Melissa, a Massachusetts patient turned medical advocate.
Thank you, Governor Healey, Lieutenant Governor Driscoll, Secretaries Mahania, Paley, and Commissioner Caljo, for this opportunity to tell my story about how prior authorization delays have caused me needless suffering and serious harm. My name is Melissa, and I am a longtime resident of Massachusetts. In 2017, I developed a serious autoimmune neurologic illness, which rapidly caused significant weight loss, cognitive dysfunction, hormonal disruption, damage to my tissues, a rapid pulse and constant adrenaline feeling, and even the shutdown of my basic bodily functions. The illness left me unable to continue a rewarding career in human services, and I lost my social circles and the many things I enjoyed in life. After several months of aggressive decline, a leading neurologist in Boston correctly diagnosed my illness and ordered the only effective treatment, an expensive drug that most health insurance plans require prior authorizations for. During this critical time period of waiting for the prior authorization process, my condition continued to deteriorate, and I suffered severe effects to my body and functioning, some of which has been permanent. Each time I contacted my doctor's office to ask about the treatment, I was told that the request had been sent, but the prior authorization approval process status was unknown. Finally, after 3 months of waiting, I got my first round of immunotherapy treatments after being admitted to the hospital due to how badly I had deteriorated. Sorry. We've been using this phrase, prior authorization process, but what do these delays actually mean for a patient? In the world of neurology, an illness like mine, 3 months is like 3 years. Why do I have to wait those 3 months and suffer that damage? I'm very grateful to my doctor for diagnosing my condition and trying to get my medication approved. If not for his help, I would not be here talking with you today. However, much of the damage to my body and nervous system might have been prevented had a prior authorization not been required. Under one of the important new rules proposed today, my doctor could have expedited my request and received an answer within 24 hours, saving me months of uncertainty, suffering, and physical decline. In closing, I want to thank Governor Healey and Commissioner Caljo for the new rules proposed today, which make me feel really hopeful that in the future, patients like me will get their treatment without the unnecessary and harmful barriers that so much of us have been forced to endure. It is now my pleasure to welcome Governor Healey back to the podium. Thank you.
Thank you so much, Melissa, for sharing your story with all of us and helping us to understand why today is an important day and will be for people going forward who, fortunately, with this change, won't have to endure what you had to endure. With that, we're happy to take any on-topic questions.
Governor, how many prescription drugs will prior authorization be removed for under these changes?
Yeah. As you might imagine, I know that there will be some. I don't have an exact figure for you. I don't know that, I mean, many.
I'll just give you a particular category where drugs will be impacted around chronic care services as an example. So pursuant to a law that was authorized about a year ago, the PACT Act provides additional relief for patients, and the regulations will track to that language in terms of drugs subject to chronic treatments for patients as one classification, but we don't have a catalog of drugs that per se.
Yeah. But we'll get more on that. But it, okay. But you know, as the commissioner said, and as I said earlier, it covers some really broad categories of care that people routinely need in the state, and that's super important.
Governor, when do you expect these changes to take effect, and will they all take effect at the same time?
Well, you know, we're filing the regulations this week, and I want them to be taking effect as soon as possible. Obviously, you know, the plans have got to make some changes on their end, back into the system. But, you know, make no mistake about it, the charge and the mission here is to make sure that this stuff is implemented as quickly as possible so that prior auths go away for, you know, as many instances as possible through this agreement, through this work. I'll let the commissioner say more, but I think basically it's looking at the kinds of treatments, the kinds of services, the kinds of care that a lot of us or our family members regularly need, and looking back through to see, like, oh, you know, after the 3 months, you know, that is something that was approved 99% of the time. So if it's something that's been approved with that frequency, right, then we should just eliminate prior auth for that drug or for that treatment now. And did I say that right?
You said it perfectly.
Well, you don't have to say I said it perfectly, but that's what we did. Yesterday. Which insurers are affected?
So all of the insurers in Massachusetts that do business here are subject to the regulations. And I just want to put a word out there in terms of their willingness to tackle these issues. And we'll work hand in hand with them to make sure it's implemented in a deliberate fashion.
Governor, I know you said yesterday, but are you giving a timeline to produce recommendations for this working group?
Well, I know the working group is going to get to work and meet, and we'll be meeting really regularly, and we're going to be having a lot of conversations back and forth. I'd like to see some actual changes and recommendations no later than June.
The House Commission already does a lot of work in terms of trying to constrain costs. Where will this work group different than what they see?
You know, I'd imagine HPC's work, and David Seltz is here today with us, thank you. That work will continue, the work of the commission, and this is a separate effort to identify, you know, what are new and innovative ways that we can do some things to reduce costs and increase access to care.
Governor, will your administration be releasing additional plans to address insurance losses at this sector and at Mass Health related to the One Big Beautiful Bill, or does this announcement address that?
No, this announcement doesn't begin to address the harm caused by the reckless and wrong-headed decision by Donald Trump and Republicans in Congress to take $1 trillion out of health care. Health care affects the quality of our life. It affects our economy. We know the toll it's taking on families and individuals who can't pay for health care in this country, and also employers who can't afford health care. So there'll be a lot more to say about this as, you know, we start to see some of the pain around the country as a result of what Donald Trump and Congress did. Now, here in Massachusetts, I'll just remind folks, look, we took action early. I'm the first governor, we're the first administration in the country to cap copays, to cap deductibles. We're also, and I want to thank Director Gasteyer. Last week, we made an announcement that we had figured out a way to ensure that people who are getting connector care coverage through the ACA plan, right, connector care coverage, an estimated 270,000 people were going to be able to see that coverage continue because the state was going to make up for the federal subsidies that Congress and Trump allowed to expire. And so I just want folks to know, like, this is hard. It's a hard area, and there's no one silver bullet to building a better system and reducing costs and increasing access. But we've got to start, and we've got to identify ways immediate, ways long-term, ways small, ways big to get this done. And, you know, as I say, I'm not waiting for Washington to act, and we'll do whatever we can. We'll continue to update you on all things healthcare, including what's happening as a result of the impact of legislation out of D.C., and we're going to constantly keep our eye focused on affordability and access to care and what can we do. I was in the mall over the weekend, and a woman came up to me and said, thank you for that announcement last week, because my daughter and husband are now going to be able to continue their care. And, you know, I heard from a number of people in the last few days, and you know, it's an example of Massachusetts leading, stepping up, just as we did under Commissioner Goldstein when it came to vaccines. They took away vaccines. Okay, we're going to build our own system and make sure people in Massachusetts have access to a vaccine, and thank you to the insurers who agreed to cover the costs. So, you know, it's not going to be easy, but we've got to dig in, and we've got to realize that healthcare in America has reached a point where it's not sustainable, it's not working for anyone, it's too expensive. Some of these things we can't control, you know, as a state, to be honest with you. Some of the things, though, and where we can, we want to take action. And I really appreciate everybody, you know, working on that over the next weeks and months to come up with some real ideas and solutions. Thanks, everybody.